Thanks for joining me again today. I thought I'd change it up a little bit and talk about breast reduction surgery. This is by far one of the most rewarding surgeries that I do. It's probably the most rewarding surgery that most plastic surgeons do, and that's really because this is a surgery that provides unbelievable results both cosmetically, physically, and psychologically, and it's one with an exceedingly low complication profile and a pretty easy recovery. So I'd like to spend the next 2 or 3 videos going through what a breast reduction is, what the results we can expect from a breast reduction, and then we'll go into some of the risks and complications, as well as the aftercare and what recovery looks like from a breast reduction. So for today, let's talk about surgery itself. So breast reduction is really designed to remove volume from the breast, so take weight off the breast. As a byproduct, but a very important one, it does lift the breast and the entirety of the breast, as well as repositioning the nipple into a more appropriate position. So a lot of patients come in and they say, well, I'm not sure if I need a breast reduction or a breast lift. That's a very common question and something we spend quite a bit of time discussing. The best way to think about that, from my perspective, is if you're wearing your best bra that fits really well and holds the breasts where they're supposed to be, are you happy with that size? If you are, then what you need is a breast lift and maybe a reshaping to improve the shape of the breast and maybe the position of the nipple. But the volume is correct when it's held in position. If in a good bra you still feel that the volume of your breast and the weight of the breast is too much, then that's a breast reduction. And what we really need to do is remove tissue or weight from the breast, and then when we put everything back together, we're going to give you that lift and reposition the nipple into a nicer, a more elevated position. So breast reduction, remove the volume and reposition the nipple, reshape the breast into a nicer shape. Many times, I would say in most patients these days, we're also performing liposuction at the same time of the breast reduction. And the liposuction here serves two main purposes. Number one, it helps to shape the breast, so it adds a little bit of roundness to the outside of the breast instead of the rectangular or boxy look that we sometimes see with age or with a heavy breast. And very importantly, it helps to deal with the excess fat or tissue on the bra roll or the side of the chest that often becomes actually more prominent after breast reduction is done and the breast is smaller and more lifted. That area becomes a little bit more obvious. And so the liposuction is done at the same time as the breast reduction. It's done through the same incisions, so there are no new incisions, and it just adds a little bit of time. Does not change the recovery aside from being sore, a little bit more lateral or a little bit more out to the side than just with the breast reduction. In terms of the procedure itself for breast reduction, the surgery is approximately 2 hours. It's done under general anesthetic, so you're asleep for the procedure. When you wake up, I wrap my patients up in a tensor bandage so you're comfortable. You've got nothing you need to look at, do, change, or worry about for the first 3 days. And when you come back to our office to see myself or our nurse, at 3 days' time, we take that off and put you into a sports bra. I will focus the next video on the risks and complications as well as the recovery from breast reduction. So if you have any questions about breast reduction surgery to start with, please put them below or contact us, and I would love to address them in the next video. Thanks for following.